Good morning to you all, um, or good evening or good afternoon from wherever you're joining me. My name is Milind Sonawane. I am a speech and language therapist. I am also working in service for people with intellectual disabilities and autism, providing services across their lifespan. So basically, from their first day of their disability to their end stage of their disability, provide services. My main intention of talking about this topic is very close to my heart because aging, which is a part of our natural process, is going to happen with all the people we work with, our children, people we care for, and people we work with. It is a very huge topic, and there is very little known about what to do, how to manage, what supports to put in, and how to improve the quality of life for people with autism. I say the journey is unknown into the unknown because very little research has trickled down in terms of how to manage, provide services. And I'll be talking a little bit more about this topic. Working over years, I have realized that this is where the services need to move in the future. We had started working with children who are soon going to be adolescents and they're soon going to be adults. So, as we all know, the earlier classic definition it was called infantile autism, and actually, I think it should read autism is for life. As we all know, with any other disability, it doesn't go away. It is just the way we treat it and the way we support it that the needs are going to change as the person or the people with autism mature and get older in their life. The American Psychiatric Association defines autism as a spectrum disorder, which is called ASD or autism with the DSM-5, are a group of learning, lifelong neurodevelopmental disorders. So it is a lifelong condition, and we all know that the core symptoms of autism include persistent deficits, which means difficulties across all spheres of life in social communication, which is the ability to communicate socially and the ability to interact in an appropriate way with your peers and with your colleagues, as well as restricted, repetitive, or stereotype behaviors. So the things they like or things they like to do are very limited, and they may have interest in things that other people may not have interest in, and their behaviors could be linked to sensory reasons, so they could have challenging behaviors based on how they perceive the world. As I was speaking to you, that we all start our journey in this world as infants. We grow into children. There comes a stage when we become adolescents, then we become young adult, then we are in the middle age, and finally we become older, or the time comes when we would need support. So as you can see, the progression at every stage, the needs or the demands that we have are different. When you are in school or preschool, education, play, they are more important. As you get child, then being able to independently do your skills, able to learn new skills and form relationships become more important. As we get into adolescence, your own identity, to deal with your puberty and to be able to make good choices in your life. As we become adults, young adults, then we want to live on our own, able to solve our problems and be able to choose a career and move into that correct direction. In the middle ages, you want to stay healthy, you want to maintain a job, you want to plan for your future. And as you get older, then you look for supports. Your health becomes important, and you have to depend on somebody providing this kind of support. Now, when we look at the statistics, this is what we know, that during the next 5 years, people aged 65 years and older in this world will actually outnumber children younger than 5 years, which means the geriatric population is increasing, and that's where most of the services will be concentrated. Aging is the biggest driver for health conditions such as dementia, stroke, pulmonary diseases, and diabetes, which are associated with age or growing age. As population lives younger, the key question that we need to ask is whether subsequent people will live longer than the previous generations, or will they live shorter than the previous generations. The classic definition, I'm not going to go into a lot of detail about what ASD is, but according to DSM, which is the Diagnostic and Statistical Manual 5, which is the most recent kind of diagnostic categories they have given, you need to have impairment in your social communication. So when I talk to somebody, if I have difficulties in my communication with another peer or with another person, and if I have difficulties in my interactions, as well as have repetitive or restrictive ways of how I deal with my life, and can lead to challenging behaviors. If I see these characteristics starting at very early in life, that's where I'm going to be making a diagnosis of ASD, or autism spectrum disorders as it is called now. Now, there has been a lot of medical and anatomical studies done to analyze the brain to see what differences are there. Different parts of the brain has been found to have difficulties for people with autism. Looking at the cerebral cortex, which is a thin layer that covers our hemispheres, the area of the brain is responsible for higher mental functions, general movement, perception, and there has been some difficulties when they studied in the autism brain. Amygdala, this is responsible for all emotional responses, including our behavior, and studies have shown that there are differences in the amygdala of children or adults with autism. Hippocampus, it makes it possible to remember new information or to learn a new skill. And again, studies have shown that there are differences in this area of the people with autism compared to typically developing people. Brainstem, cerebellum, basal ganglia, these are all different areas in the brain which have been implicated and which have shown by repeated research that there are subtle differences in how the connections are formed and how informations are processed in these centers. Now, as you see, if you look at the brain size and how the neurons populate them and how they grow and how they make connections, um, during the early life, there is an overgrowth. The red one that indicates the children in autism's brain development, and the green one is the normal development. So as you look at the age, early in their life, there is too much of brain cells or neurons which are impacted together. They start following the normal curve, and at an older age, it actually drops down, or there is attrition of some of these neurons. So an example would be 67% more prefrontal neurons have been found in children who have got ASD. So generally talking about any kind of disability, a lot of information I'll be talking today is about autism spectrum disorder, but it can also be implied to children who or adults with Down syndrome or neurological conditions or genetic conditions, because uh, s- bar certain differences, most of this information can be applied to everybody. So as we all know, that disability can occur at any age or race. A lot of us acquire disability while from the time we are born, or we could also acquire disability as a result of accident injuries. It can happen very early in our life, it can happen late in our life. We can predict the course of how the disability is going to develop or progress over the period of time, or sometimes it can be unpredictable. It's a dynamic condition, and minimal to significant challenges can arise depending on how and what stage of life the person is in. So why is it important for us to think about this concept of aging? And all the things that I'm going to talk today about is looking at the cost. So a lot of studies have been done, and I don't have much data from the Asia. I have some data from Ireland, US, and other countries. So health economists, they have found that there's a high financial cost to provide services to people with autism. So the annual medical and non-medical cost of ASD in the United States will be 268 billion for 2015, which is projected to rise by 461 billion for 2025. The research conducted by the academics, which is a university in Ireland, is the Galway University, and they have found that the average annual cost per child for families who had a child with clinically diagnosed autism spectrum disorder would rise to 28,464 or nearly 29,000 euros, which involves private ASD services or loss of income or informal care that needs to be provided. And much of this expenditure is for adults largely because of the cost of medical care, residential services to be provided, and the supported living accommodation, and loss of their own productivity, as well as loss of productivity for the caregivers. So all these factors are important in terms of cost and budgeting and looking at what the future looks like. What's the prevalence of disability? Again, from the European standards, 80 million of the people, which means 15% of the population in Europe, has got some kind of disability. Or, if to put it into terms, one out of four members in a family may have some kind of disability, and this could involve physical disability, cognitive disabilities, or any other kind of disabilities. I think it brings us to an interesting question about expectancy of life. Earlier concepts, we used to say if a person turns 50, he's old. But I think the concepts is changing today. Most of the people, even in their 60s and 70s, are working, they are productive, they are working hard, and that would be something that the definition of old age or old has to shift from 50 towards 75. So 70s, 30% rise, by 30% the risen population in terms of how we diagnose and what we call the life expectancy. People are also aging early, and also the healthcare services which used to be provided in the past nowadays are getting better with advancement in medical technologies and ability to record and analyze and our ability to understand disability. So although people are aging early because of other factors, there's also improvements and understanding of how disability is to be managed. We all know and we all have experienced that having a child with disability or an adolescent or an adult with disability brings in some additional demands on us as family members. So the impact of child disability on the family that have been found as having an infant with a serious health condition or health risk increases the likelihood that parents divorce or live apart. So this is just one of the studies that has been found that usually there's a high rate of divorce in parents when they have a child with disability because it's difficult to manage. It is something that is difficult for parents. A lot of time the blame is put on the mother. A lot of times other factors are taken into consideration. There is stress, there is job losses. Who is going to stay home? Who is going to cater to this child? Who is going to take them for therapies and medical procedures? It also has an impact on a family as such. There is increased bills because you are incurring extra cost for therapies, medical interventions, physiotherapy, speech therapy, occupation therapy, which brings in financial burden. You have to sacrifice your job or have to change your job, so which might bring in less income. Childcare arrangements become very difficult because you have to find somebody suitable. You might have to pay somebody extra to take care of your child. Your family routines can get upset. Going to movies together, having a meal out, all could be challenged. Family activities. It also has an impact on other family members as siblings and grandparents and extended family members. And of course, it brings in more stress for people in their life. Now, the services in the West or in Ireland have actually started moving. Earlier, there were a lot of institution-based care, and now they are moving more towards community care. So, which means that they have to be integrated in their own community where they live, in their own village, in their own city, in their own environment. Segregation. So having these people put into special schools, teaching them different way, they were all segregated, whereas there's a move now to integrate them, and there's also what we call reverse integration. So rather than they going to integrate with somebody, children from typical school come down to integrate with them. and also the services are more focused on trying to make them more independent than making them dependent on key service players. And so we have to think about the impacts that this change is going to bring. What is reality, and does it bring change in the cost? Engagement, that we have to engage with people, stakeholders, family members, does it reduce or increase? And in terms of challenging behaviors, might open up more, it might lead to more challenging behaviors because things are changing and they're managed differently. um, a lot of countries, the services are regulated and modulated by legal terminologies and what laws are existing. If the laws are strong, if there is a fair laws, then service providers like us have to be cognizant of those laws, and we have to be able to provide those supports and laws effectively to be implemented. When we say lifelong support, we have to look at every stage, or different stages brings in challenges of different types. So the first stage could be awaiting diagnosis. So at that time, the impact could be is to get a proper diagnosis. There could be rise in challenging behaviors because there is no communication system or no sensory intervention while you're waiting for the diagnosis. You can have a recent diagnosis where you newly got diagnosis, but you don't know what. So you could have a recent diagnosis. Family members are very young parents. They don't know how to manage. They don't know how to access services. They don't know how to access the healthcare services. So diagnosis, therapy, early interventions when they're in school. So being able to educate yourself, able to take care of self. There could be social isolation. There could be a bit of bullying for these children in the school. As they get into adults or adolescents, then there are limited social activities or limited social engagements they can have. Um, they get into adulthood, and there is also a lot of grief if somebody dies. So we all have to be taking these things into consideration, that every stage of life the child or the person with autism will bring in challenges, those which need to be addressed effectively. So they did a survey with the parents, and this is an older survey, but they was done in 2000 in Ireland. And what they wanted to know from the caregivers or the parents of children with autism is what kind of questions do they have for their children who are growing into adults. So the questions that were highlighted were, what sorts of life will our children have? How will their needs be met? Where will they live? Will they live with the family? Will they live in sheltered houses? Will they be living in semi-structured houses? How will they spend money? So whatever money they have or whatever money the family gives them, how will they be spending their money? Who is going to take care of their medical, social, and emotional needs? Will they be able to independently navigate their daily living skills? Will they need support? And will they retire and live a good life? So these were some of the questions which were raised by the caregivers, by the family members, by the siblings. And that's when more directives, and this report was submitted to the government and the health service executive, which is the health body providing services to people with disabilities. And lots of working reports has been generated, and a lot of directions and laws have been amended to take these things into considerations. As we all know that autism spectrum disorder, we tend to think about this as a childhood conditions. Most of the focuses of the services, hospitals, schools, intervention services are so focused on providing services to children, which I'm not saying is incorrect. But if all the focus is put into childhood or early school years, then when they get older, adolescents and adults, very little is left in terms of finance, in terms of services, in terms of manpower, in terms of trained professionals. So as we know that ASD is a lifelong condition, and supports and treatment changes as the condition progresses. And we do not know in what way this progression is going to happen. It could be positive, it could be negative, it could be slow, it could be fast. Now, early diagnosis of autism can definitely reduce the lifetime care cost by two-thirds. So the rising from 1 is to 59 accommodate the pressing need for supports and programs for people on the spectrum across the lifespan. So this is the latest statistics that one child out of 59 children born is going to have an autism. So you can imagine the impact it's going to have on the family, the society, and the country as such. Quality of life, we always talk about it. So the quality of life depends on what ongoing supports are there specific to their educational, medical, social, recreational, and family and employment needs. So if you do not have an inclusive society, if you do not have an inclusive community, if you do not have an education system which supports their education, if you do not have a medical system which is geared towards understanding the medical needs of the children with disabilities, if the society is not supportive, and if recreational facilities are not available, this is going to push the cost and is going to decrease the quality of life for people with disabilities. People with disabilities in general, we know and research has shown that will experience poorer health and less access to health care. They go for few health checks. Their blood tests are not that often or common. Cholesterol check, cancer screening doesn't happen as frequently. It may happen with you and me. There are no trained professionals to provide services. People working in these industries are not specially trained to deal with somebody with autism or somebody with Down syndrome, so they find it very hard to get the medical data and understand their medical histories. There's a high prevalence of complex conditions like they have visual problems, hearing problems. There could be a lot of comorbid conditions. Mental health is a big issue for children and people with autism, behavior problems, and constipation. All these things are very complex if you cannot get the history and if no proper medical records are put, or if the person assessing, treating, or analyzing them is not trained to work with people with autism. We also know that people with autism spectrum disorders are at higher rates of poverty because they do not have a stable income. They are not productive. They have poor ability to communicate, which is the core symptom that they are not able to answer questions. They are not able to explain exactly what's wrong with their body, where the pain is happening, how long is the pain happening. So it's very difficult for a medical professional to ascertain the exact cause and where the pain in the body is. And a lot of times it's lack of family support. If the family picks it up, they're going to take the child to the doctor. Otherwise it's been put up as behavior challenges or a sensory problem, and a lot of them is ignored and not taken care of. What have we seen specific types of difficulties in children who are on the spectrum? So anxiety is very common. OCD, ADHD, depressions are associated with psychological difficulties, at least in 40% of the population. Aging, we all age and we all know that things are going to decrease and we are going to lose our skills and we are going to lose our eyesight or we're going to lose our hearing. So, changes in the domains of memory, so executive function and intelligence, the skill for independent daily living and life management, such as employment, planning skills, taking medication, remembering doctor's appointment, they're all going to happen in our body as a part of aging. But what has been found is that people with autism or with any other disabilities actually age much quicker than typical aging, which means these things will start much earlier than it actually starts in a typically aging person. Risk of dementia and Alzheimer's increases with age, and there has been a lot of studies again done to indicate that dementia or Alzheimer's is quite common in people with disabilities with Down syndrome and Alzheimer's. This is just a health comparison of what they have done studies and found. GI issues in 60% of the people, allergies, sleep issues, skin conditions, seizures, asthma, ADHD, OCD, anxiety, depression, and bipolar disorders. So this is just as you can see that 60%, at least 60%, 70% people are going to have these kind of difficulties which they won't be able to explain and won't be treated on time because it's so difficult to know, but this is just from research we know that. As I also said that ASD is a comorbid condition. What I mean by that is ASD or autism spectrum disorder diagnosis also brings in additional issues or difficulties in terms of having an ADHD, anxiety, Tourette syndrome, OCD, sensory integration disorders, depression. All these things can have an impact on your general well-being and on your quality of life and your health. Just an example there of what a healthy brain looks like and how the neural connections are to bring the signals and impulses to the brain. Whereas in Alzheimer's, we know that the brain is shrunk and the plaques are formed and the neuronal connections are not working as effectively as they should be. You can imagine the impact those neuronal connections, plaques can have on bringing information to the brain. They also found that people with disabilities may have high risk of falling at an early age due to the seizures, and they have found that more females than males are prone to seizures and falling down. So training on balance programs early to prevent falls, or using helmets, or working with occupation therapists or physiotherapists would be a way to stop or decrease the number of people falling at an early age. um, Behavior problems, it's also so challenging, and understanding why somebody is having a behavior problem. A lot of people we work with would have difficulty understanding what a medical procedure is. Even getting their bloods can be a challenge. They may have fear of medical procedures, and they do not know what their legal rights are to refuse a treatment. Like, we all would only agree to something because we know whether it's right or wrong for our body, and we may reject something, and we can have law at our side to say, okay, I don't want this thing to be implanted in my body. Whereas people with autism do not have that capacity, or do not are not provided with that option where they legally refuse a treatment. Like, peg feeding is quite common. So when they have difficulty eating by their mouth, they are usually fed by a tube from their stomach. But that's a legal thing. If you don't want that, you can reject it, but you need to have the ability and capacity to do so. We also know there is a constant change of staff. There's a lot of burnout in our profession. People come in, people go, jobs are changed, less skilled people come in, more skilled people come in, they stay, they go. They do not take proper medical history, are not trained to take proper medical history. They have poor ability to describe their symptoms, and all these things actually make the job much more difficult for healthcare providers. One of the solutions is to make a health passport, which is like a communication passport, and it records all their health needs in quite detail from an early childhood. This is a computerized kind of a program that we use, and it can be updated and it can be passed on from one person to another person, so there are no gaps in understanding where the health needs are. We also found that obesity could be one of the big things because of their poor understanding of nutrition, and there's a need to change in the dietary habits, because a lot of them, as we all know, with autism, are picky eaters, and they are slow movers, or their expense of energy or activities they do on a daily basis is very limited. A lot of them are very picky, and they may eat certain kinds of food, making them obese or making having them difficulties digesting, leading to constipation. So they have lack of knowledge of the healthy diet and do not understand what is a healthy diet, and their reduced ability to shop, so they are dependent on somebody to shop and cook for self. So even though they want to be healthy and they want to stay healthy, they are basically dependent on somebody else cooking something for them, and the person taking care of them may not be thinking about these things. Weight gain could also be due to medications. A lot of medications they take could have a side effect of gaining weight, and a lot of depression could be seen because of difficulties with the food or the nutrition that they are taking in. So adults with ASD without an ID are not met in that. There are challenges in this field that I'll be talking about, that needs are not assessed, and therefore no investment is made to provide services. So since it's a difficult area, nobody's thinking about it. Governments are reluctant to make investments, and even though you have money, you do not know how to invest and where to invest this. Adults with disabilities drop out of further education or are unable to access or remain in employment, and we know that, and they are at risk of being dependent on benefits and facing social exclusion, because that's how we see look at people in society, is that you are supporting somebody, so you are in a power position compared to somebody who's getting the services. Different rules in different parts of the system often mean that a person with autism loses supports when they move from one part of the system to another. The system here in Ireland is when they are in school, they get a support from their SNA, which is a special needs assistant. As they go into secondary schools, SNAs are not as often given to them as they are given in the primary schools. As they get into tertiary education, a lot of these supports are gone, and that's when the challenges become even more. And as they get into adolescence, these supports are completely non-existent. There is a lack of defined pathways for services and difficulties with access to adult services. So organizations, parents, or service providers haven't been thinking of the pathway that somebody who is 10 today will be soon 20, is going to be 30 and 40, and what kind of clinical services or pathways are needed to provide effective services. This is lacking. Lack of multidisciplinary intervention, because most of it is so focused on early intervention in childhood and school age children, that experts in terms of dealing with people with adolescence or old age is literally very little or non-existence. In particular, psychology support and behavior therapy, which are important aspects in the older age, are kind of not great in terms of supports. There are also lack of employment options for people as they age and have a disability. Lack of family support, in particular support from parents who are involved in caregiving for their adult children, because they themselves are getting old and they themselves are aging as well. For adults, there is no clear pathway for getting a diagnosis of ASD. So again, there are you can diagnose ASD at any age. A lot of times, if you lived your life, if you got a job, or if you're able to manage yourselves, even though you could have autism, is not really diagnosed as autism. Whereas here in our services, we have started diagnosing older adults or adolescents with autism, because it does have a huge impact on their life, as well as to access services and interventions they need to have um, diagnosis. There is a law in Ireland, it's called AON, or Assessment of Needs. So within 3 months that a child is identified by general practitioner, he needs to get his diagnosis. This is a law. Talking about the challenges some more, it's like walking on a wall, very thin line. What do you do? What do you not do? You want them to be healthy and you want the clients to be independent. There's a lot of stereotypes. You're aged, you don't need this, you don't have to do this, you don't need recreation, you can sit at home and watch TV. Provisions are based on ability, so that's where a lot of provisions are. Oh, you can do this, or he is able to walk, so he needs to go out, or you're in a wheelchair, so you don't need to be going out because you're in a wheelchair. Integration regardless of age. So again, integration is not only for school age children, but adolescents, adults, older age. We have specific trained volunteers who would go out with adults in our services for a glass of wine, or they would have social activities in recreational clubs that they would access. There are a lot of inequalities in the healthcare sector, and they need to be removed in terms of how people are perceived with disabilities accessing healthcare. There's lack of information on aging as such. So, what profile changes? What skills do they have difficulties with? What skills do they keep intact? How is it different in people with disabilities? I think that kind of research is in very much infancy. Social isolation, lifelong and lone carers. So there could be somebody, one person caring for that person for a lifelong, and that person could be burnt out or tired or getting older or may have their own health difficulties. So we have to treat carers as equal partners and support from present and future. So they need to be presented uh, training and support, and they have to be kind of trained for future needs as well. I'm going to talk a little bit more about Ireland and how things have changed in Ireland from the 19th century. As we all know, Ireland is a Catholic country. Catholic identity was brought into health, education, social care in the 1900s. 20th century government started looking into this and gave some funding. 1950s nurses were employed and professionals such as speech therapists, occupation therapists used to be employed in the services. 60s and 70s, voluntary bodies developed by parents and professionals. 65, institutional cares moved towards community care. The organization that I work was established in 1960 and today provides services for more than 2,000 people, and it was an organization made by parents. 1970s they started thinking that these people will need housing and parents are getting older, and if the parents can't take care of them, where do they go to stay? So the residential services were started. 2012 value for money, so people who are whatever retirement benefits the government gives them, they are equaling to giving them residence or accommodation, and similar principles are being applied for people with disability. So there's a lot of changes that the government policies have done and how the healthcare has moved in Ireland. What I want to say is, how do we deal with a question or a problem like that? I think there has to be a cross system focus, not just working on one thing is going to help us to look into this bigger picture. We need to work on their health and wellness. Are they healthy? Are they living well? Are they following a proper diet? Are they exercising? Are they getting out into the society? Housing, what kind of residential facilities do they have? Are they going to be living on their own? Are they going to be in supported housing? Are they going to be in fully supervised housing? How do we sustain their education, training, and employment? Because they are important factors for somebody's well being and mental health. Transportation, because of their difficulty with their physical disabilities or with their challenging behaviors or difficulties with noise or sensory issues, a lot of them don't access services and don't have ways to transport. Financial planning, how much money do they have, if they are getting well from their families, if money is being transferred, how is that money being used? And one of the most important things that we always forget is the recreation piece, that all of us in our lives need something for recreation. And if there is no outlet or if there is no opportunity for them for recreation, then I think they're going to be having difficulties with having a quality of life. So, healthy and successful aging is to minimize the risk of disease and disability. So, we can minimize them, cannot take it away. Maintain physical and cognitive function. So, they have to be active, healthy, moving, exercising, meeting people, and they continue engagement with life. Aging doesn't mean that you stay in your house, in your residential home, you get fed, you get changed, you watch TV for the whole day. So promote a very healthy lifestyle. They are at a high risk of developing chronic health condition at an early age. So because of their biological factors, poor ability to assess and lack of communication and access to healthcare. So changes need to happen in all of these areas so that we can provide them early interventions and early treatment for any kind of disease or disorder they could be facing with. There was one of the studies and they found that adults with disabilities watch more TV, and over 4 hours to 6 hours of their time is spent in just watching TV. They have poor intake of vegetables and fruit. Their diet was very high in salt, and a lot of them drank very high fizzy drinks. Oral hygiene has also been identified as an area of poor difficulties like brushing or looking after their mouth because of sensory reasons or could be because of any other reason. So a lot of information has come from UK that we follow here in Ireland, and one of the systems that has been developed in UK is called the class model. What it says is there's heterogeneity of needs, so one size does not fit all. So we'll have to make accommodation based on the disability. We have to provide the services, and based on the severity of the condition, the supports have to change. So we have to recognize that disability is a multidimensional, dynamic, and it's variable. We've spoken about that. There's a need for an ongoing assessment and reassessment. So somebody who is assessed today, needs to be reassessed in 1 year's time in all aspects of his medical condition, his vocational, educational, social life. Again, they need to be assessed on a regular basis. Need for supportive services spanning home, community, and work environments. So they need to be supportive in these areas. Training the individual and family caregivers in the use of any technology for effective and safe use. So use of computers, use of smart homes, use of smart gadgets. A lot of these technology training can be provided to the caregivers so they can use this with their people who are dependent on them. Support needs of family caregivers to enable their continued effective assistance to person with disabilities. As the people with disabilities age, or as they have medical conditions, the caregivers also need to be trained on how to look after them better. We also have to be sensitive to cultural preferences and health literacy. So literacy about health and what is accepted and what is normed in a particular culture. Solutions should focus on prevention, risk reduction, and maintenance of independence at home. As long as they can stay home, as long as they can be independent, as long as they can be supported by family, uh, longer they can be supported, the it cuts the cost. Of course, there will be a point when they cannot be provided support or they cannot be catered at home, and only then they need to move out on specialized places or organizations which provide those kind of services. Similarly, a kind of similar thing here, health and wellness for people with autism, increase the awareness and rates of early diagnosis, provide evidence-based therapies and delivery of services, implement family support systems, support to access public education, vocational training for people with disabilities, and participate in high quality research and surveillance. I think that's where we lack. We do not have high quality research into aging and especially aging and disabilities. Solutions can be social and environmental conditions, can be modified to accommodate changing needs and which are associated with physical or cognitive losses and support independence. So as long as we can support the independence, it's going to help them. Possible solutions is having personal assistance. A lot of these people would need one-to-one assistance or they would need some kind of assistance throughout their life. If organizations can look into providing and training people for assistance, it would cut down cost on other aspects of their health. Training in devices, use and simplifying self-care tasks. So training in multiple devices, using technology to aid cooking, watching TV, supporting showering, themselves. Supportive services, caregiver training and support is important. Home repair and maintenance of devices. So if they are living at home independently, an occupation therapist can look at their housing adaptations, can look at how they access their things at home, opening their door, opening bottles, opening their refrigerators. Digital technologies and computers and softwares are big into this industry, and there are lots of technology supports for people who are aging, and similar technologies can be used for people with disabilities. Health technology can be purchased. Smartphones, we all know that we have smartphones and apps coming into our lives. There's big way that smartphone technology can actually look into. So there is an app which can look into your sleep patterns. It can look into medications, the effect it has. So there are a lot of apps that can actually record this data and can be provided to your medical practitioners. Home modifications may be necessary, so making ramps or things, transportation, special adaptations to your vehicles may be needed for people to be transported. Um, Looking at the Irish healthcare model, health is provided by government healthcare, and the HSC, which is the Health Services Board, actually provide acute care. They provide the social care, they provide the mental health care, they provide care in doctors, optometrists, primary care. They also have a branch which provides care for the social care and early and disabled people. And there's a quality and patient safety board which controls all this. So basically, it's a well coordinated system and looks into different aspects of how services are provided at a government level, not just privately owned. Person-centered planning. So it is a tool that we use quite often, and people working in the industry are quite familiar with this tool. That services have to be the person receiving the services has to be at the center rather than people around him making decisions for him. So it is the person at the center, and services have to revolve, whether it is medical care, whether it is diet, whether it's housing. The person makes the decision. If the person does not have the capacity, then we have advocates for that person who can decide what's right and what's wrong and what's useful for that person, rather than we making the system. There is an app now that actually records your person-centered planning, and it can be transferred from one service providers to another service provider. So what are some of the lessons we have learned from working with adults or people moving towards their adulthood? Social connectedness and their mental health is prime importance. They need to be connected in society with people, with their peers, with their family members, and that improves their mental health. Multi-dimensional ongoing assessment, so not just looking at their speech or OT or SLT needs, but looking as a person as a whole. Supporting the caregivers is such an important aspect of this puzzle. Heterogeneity, so it's not just one size fitting all. Training in the use of technologies, supporting the needs of family and caregivers, and supporting services for home, community, and work is also important. So some of the other things that we can provide is family-centered planning, so we can get the family and they are at the center of the planning. Use of technology aids or universal designs. Understanding of aging, connectedness, friendship can be maintained. How to provide palliative care, dementia care, because we know that dementia is going to be on rise in people with disabilities. We need to know family priorities, collaboration with different bodies, funding agencies, government policies, law, important. Collaborative models, like we provide training for parents, is called a Hannon training, which is a Canadian model. State provided health services. So in, as I said to you, in Ireland, government provides all the services, which is GP or dentist or speech and language therapist and occupation therapist. All those services are not great. They are provided to a minimum standards, and people can buy services if they need to. Just an idea that in Ireland, census are very important to deal with what services are existing, how many people are going to be disabled, how many people between the ages of 10 to 15 are living with disability, what kind of disability do they experience, which part of Ireland is providing good services, how do we record this data, how many males and females are there with disability. So there's a detailed statistics done, and this report is prepared by the Central Statistic Office. And these are important to guide us in our future and looking into what kind of services to be provided and where the needs are going to arise in the next 10, 15, 20 years. So I think it's an important piece of work. Although this census is from 2016, I'm sure there's latest census out now looking at this more. What's the benefit in Irish model? So there's a robust focus on disability by government policies, family and staff training, an important part of my job, as well as organizations where I work for. They work on the ICF model, strong sense and commitment to volunteering, building lifelong supports, meaningful engagement in social, leisure, and housing, collaboration of government and private funders, and they're looking at evolving models across the world to change the models here. We also know some facts that we have known. Research into autism in the teen years and beyond is still in its infancy. Very little is known about the course of ASD through adolescence and into young adulthood. So there isn't much research, or we do not have access, or we do not have much research coming into that area. Autism is a broad spectrum, and adolescence will affect each child differently. If recent studies are an indication, parents generally can expect some of the following along their child's road to adulthood. So behavior improvements across the spectrum. So we do see as they get older, their behaviors may improve. Adults with autism may be less hyperactive and irritable, and fewer repetitive behaviors as they get older, like lining things up, and dysfunctional behaviors get lesser than as you see in children. And they also get better in their daily living skills, keeping track of cash or making their own meal. Now, challenges do still remain in their adolescence. Sleep problems also persist into adolescence. Insomnia, daytime sleepiness become biggest concerns as they get older. Anxiety related to mental health issue gets higher as they get older. Managing their social situations with limited or no support is a challenge for them. Building, maintaining friendships, relationships is challenge. Making career choices, managing their leisure time. They don't know how to manage their time and they do not have activities to manage their leisure time. Developing their independence, decision on living away or with family or somewhere else, and managing their own finances remain a challenge for them. From an Irish perspective, the fact that condition severity is significantly associated with higher out of pocket expenditure, but no state level expenditure is also potentially instructive. As the child or as a person with autism is more severe, it puts more burden on the financial package of the parents or the service providers because you need more supports. It suggests that the state may provide a basic level of service. So even in Ireland, services or finance is not based on how severe you are. It is only based on the diagnosis. So even though you could have ASD with no challenging behaviors, gets the same funding as somebody who would require extra supports in terms of manpower or more medical visits or more intervention. European research shows that ASD is common condition. Better identification and expand definition is are we expanding the definition or is there a truly increase in the number of autism cases as we see? Creates great concern about causes. Research takes time and money, whereas families are now dealing with autism. So how do we support them? Increase in people needing services trains already tax educational system, so the more services are needed, it is going to tax our education system. Special educator costing, residential costs are going high. Lifetime supports are necessary. Need for family support, need for professional training, and impact on society. So in summary, research on outcome in adults life for individual with ASD is growing, but finding remains inconsistent and often conflicting because there isn't enough research on that. There is a contradictory evidence on how many individuals with ASD achieve good outcomes as adults and lack of agreement on how this should be measured or how prognosis might be improved. So it's very hard to use a standardized assessment or a scale to say this is what the progress was made, and there is no consensus on such a tool as such. In particular, data on psychiatric comorbidities in adulthood vary widely, and it remains uncertain how many individuals do experience serious mental health problems. So, as we know, they're going to experience serious mental health problems, but recording and treating them is a challenge. Nevertheless, despite lack of agreement between studies, overall outcomes for adults with ASD in terms of jobs, relationships, independent living, and mental health are considerably poorer than for same age peers. So when you compare people with autism and typically developing aging population, people with ASD are at a definite disadvantage because they struggle in all these areas. And knowledge about factors that are associated with good or poor social and psychological outcomes remain very limited, with few studies considering family, social, or wider social influences. So studies do not actually focus on looking at the bigger picture. They are basically looking only at interventions in multidisciplinary team or things like that. So that's the end of my presentation. If you have any questions, I can take your questions. I would also like to thank Autism Connect, which website which provides services for people and professionals and parents, and you can log on to Autism Connect for more information. I've got some questions here. Somebody who has got a 3-year-old child and looking for. I have a son 3 years old and his autism speech is not clear and we want to guide to make him start speech until he grows to 5. Please provide us some guidance. It's a big question and would require a lot of assessments from professionals working with your child. Has he been seen by speech and language therapist? I'm not sure. that would need a multidisciplinary assessment. Wherever you're located, you can connect with professionals through Autism Connect, and that we could look at what is causing the speech delay. Not sure. There was a question there from Aparna saying that she can't see or hear me. I'm not sure if that's a technical problem and how can that be. Probably that was sorted during my presentation, not sure. Question was, it has been informed by many doctors that 3 to 5 years are very important in that speech can be developed, but how do you do that? And we need guidance on that. Again, kind of a similar question to the first question there. There's no one technique that can help your child to speak. There are different techniques, and based on the ability of your child, I would say whether he can speak verbally or non-verbally, even is he using PECS, which is the picture exchange communication system. Not sure unless we assess the child, difficult to answer, but if you can connect with professionals such as speech therapists, they probably would be able to answer your questions. How to avoid repeatedly actions such playing with some bottle wrappers, and when it takes time it starts crying and it does not for more than 1 to 2 hours. Again, we'll have to look at is there any replacement in terms of what he's playing with. Playing with same things gives them consistency, and that is something that we need to slowly change into through behavior techniques, and we might have to find a replacement for them which gives them the same kind of engagement and take away something that they're lining up repeatedly. Question about how to choose the right therapist for kids to 3 years old. Again, somebody who has got experience in working with autism. I would have got 20 years of experience working with autism, and that's what I would say that I'm looking for is somebody who's quite a experience in working with wide range of children. Somebody said it's very helpful. I don't know what that is. Can you guide us for speech therapist Ahmedabad? I think I leave it to Autism Connect, and they might be able to get you in touch with somebody who's in Ahmedabad. This question from Mr. Das. My son is 4.5 years old, and the doctor is saying that he has mild autism or selective mutism. Few more sessions. I have to go to know the exact disorder. What to know something about selective mutism. So selective mutism is nowadays called as elective mutism because those children elect to speak or not speak. It is a social anxiety disorder. Speech therapists and psychologists work together. I would ask you to consult a psychologist as well when working and looking at your child who is electively mute in a certain situation. Somebody says, I would like to know what foods impact the brain. Sorry, I cannot answer that question. It's a balanced diet that I know that you need to have in order to be able to supplement all the nutrition to your brain. It does have positive and negative effects on children with autism is what you eat because they are all picky eaters and their oral sensory issues could stem from being able to eat or not eat some foods. How do you diagnose autism in adults? So again, a very good question by Miss Sonali Dhawan. We use tools called as ADOS or DISCO or ADIR, which are parents-based interviews. We have to observe the person in their natural environment. We have to see them in their office, their working environment. We get questionnaires to be filled up, and putting all the information together might help us to diagnose somebody with autism in adulthood. How do we control repetitive behaviors of children with ASD? Again, a very big question. We'll have to think about why is he doing it? What is he doing it? What can we do to replace that behavior? Working with psychologists and speech and language therapists, is it sensory? So OT could be another person in this picture that we need to look at. Which is the best country, city, town to stay for autistic kids and adults? I don't know. Any country would be fine if you can access services, whether remotely or from direct service providers. Please tell us important points in family counseling, especially in deaf disability. So I'm not sure of this question. If it is reading to deafness, I think you need to be looking at services that provide specific information for people who are deaf. Not sure if I can answer that question now. Up to what age or class they provide shadow teacher to child? Again, depends on every school. Some children can get shadow teacher till the age in their primary schools, and some can get there in their secondary schools. I want to ask a question. Any digital intervention tools? Yeah, there are many apps available. I can share some of that information with you if you're interested, or I can share it through the medium of Autism Connect. Uh, I have a child, 14 years old age. Give some suggestions on improve social thinking. Very difficult to give that one-liner here. Social thinking is the ability to put yourself in somebody else's shoes, as we call it's called the theory of mind. Not sure if you heard the terminology on theory of mind. There's a lot of social thinking curriculum available, and there are a lot of programs called Superflex, which helps you in improving your social thinking. Up to what age or class, Shadow? I think I've answered that. Also, how to improve school classroom seating. If you're talking about attention concentration, there are issues that children with autism would have. So, breaking your task using visual supports, providing sensory intervention to your child may improve his seating in the classroom. Do you encounter more female or male patients? What would be reason? Of risk. ASD is one gender. No, ASD, yeah, of course, we do see more males getting the diagnosis than females. Females, the autism is more subtle. They can hide their autism, whereas with males, it's more obvious. It's also a gender bias. We don't think autism is in females, but it does happen, probably to a lesser extent. My son is 27 years, high functioning, does speak to himself even if he's engaged. How to control? Again, I would be looking into why is he speaking to himself? Does he have company? Does he have social interaction with other people? It could also be a sign of something that I need to talk to my psychology about, or talk to a psychiatrist about self-talking. How are services in India for adults with ASD in India in comparison to other big countries like USA? I think very different. Every country in West have their own healthcare systems. They're very strong, solution focused, good interventions, good outcomes in the adult age. India services are developing. There are very few services. I do know of services which are providing residential supports and care for people. Not sure where they are based, but a lot of them are all over the place. So you'll have to do a bit of research on that. How important is IEP? IEP is an important thing for your autistic child. We do an IEP, we review the IEP every 3 months in Ireland or 6 months based on the need. So it is a platform for you to set your goals. It's a platform for other people to connect with you and make sure that you're working on the right progress of your child. Please suggest some family counseling tips. Not sure what family counseling tips you're talking about. Is it about dealing with disability, dealing with autism? I think if you're supported by your society, community, and service providers, that probably would answer a lot of your questions that you have. Funding is quite expensive in my setting. How do I seek funding? How do I seek assistance? I do not know. My child is going and now he is into private tuition. Uh, a good question again, as I would say that a lot of organizations in Ireland are set up by parents. So there's a need for parents to come together. There's a need for organizations providing services to work alongside with the parents' organizations. You as parents can be a strong voice, and financially you could plan much better services for your child when you come together as parents groups. How to manage behaviors, a 14-year goal, how medication helps. Not sure again, medication can have a lot of side effects. So before we put somebody on medication, we would exhaust all other techniques. Healthcare professionals work with the person, psychologists would work with the person. There are medications. We would have psychiatrists coming into our services and providing medications if they are necessary or needed. Is there any association who can take care of special children in absence of parents? Means after growing up, as we can't say parents can live. And that is a question I'm trying to talk about is
link in with organizations, look for services from early age so you can know. I know the services are not good in India, but I think they are developing and they are coming up. So there are services. There's an organization called Arunima that I work with, and they are providing services in their older age. And there are other services as well that I know of in Delhi and southern part in Hyderabad. So you can look up at services to see what services are being provided. My son is 4.5. He's getting ABA. He can use few sentences for his needs, understands well, but a new person's talk to him simply ignores or don't reply. So again, a very specific question. People with autism don't like to interact with others. That is their core deficit. So we have to look at if he's talking, is he still able to communicate his needs? Does he need to look at the person? How do you get him to look at the person? Are there games that we can play that would help the person to interact and look at your face rather than forcing him to look at your face? I really enjoyed this program. Please send a copy of this webinar. I think Autism Connect can do this. Please share app details. I will do that. Funding is quite expensive. How do I seek assistance? Since I have support, I do not have support from anyone. My child is 14. I think similar question that I answered there. Suggest a therapist working in Bangalore. Not sure, but Nimhan should have somebody in Bangalore, and there are some private clinics. I can look into that. And there's another question about hitting behavior of the child in a normal classroom setting. Again, I'll have to look at what is causing the behavior, what is the, as we call the ABCs, what is the antecedent, what is the behavior, and what consequences is it getting. The recorded data has to be tracked for a few months before we can make a suggestion on what is the trigger for the behavior. Thank you. Is this correct to send autistic child to normal mainstream school? Yes, if he's capable of, and if the school is accepting, I would send my child because you want to learn them from proper models. Can an autistic adult marry? Not sure how to answer that question. Depends on the ability and the consent that the person can make. Does he have the legal capacity to make that decision? Does he understand the responsibilities of being married and other aspects that I would look at? 7 years old, getting difficult for searching inclusive environment, not sure which city you're based in. Autism Connect may be the platform to look for services, not sure. What aspects of early intervention are important in general? So when you're in early intervention, I'm going to look at, is the child ready for school? So what we call the school readiness skill, is the child using gestures? Is the child having eye contact? Can he follow commands? Can he sit on the chair? Can he understand a simple story? Can he understand the routine of the school? These are some of the things that I'm going to be looking at in terms of precursors for language or school placements. Could you throw some light on the reaction of parents of guardian when told the child has autism? I get this question every day. Parents react in different ways. Some are shocked, some are relieved, some are happy, some get annoyed, some get angry. So it depends on what emotional journey or phase of life they are going through. And it is my job as a professional to be able to support them no matter whatever level or whatever uh, you know course of life they are in. So the SLP says he wants to socialize, that's why he's eating. I don't think so. That's what the right reason is. Hitting is a form, any behavior challenge is a form of communication. If your child is hitting, he's probably having some sort of communication difficulty where he's not able to express his emotions or anger or displeasure, or maybe wanting certain things his way. So instead of hitting, I could teach him a communication word or a picture to explain what he wants rather than hitting. But the teacher doesn't know how to help him with that, and that's what I'm saying. That you will have to work with professionals to answer or figure out why he's hitting, when is he hitting, how frequently is he hitting, what happens when he's hitting. Only when we look at the whole data, probably we'll be able to get a better picture. This one only says Hyderabad, so I'm not sure. Are you looking for services in Hyderabad? There is a residential place in Hyderabad that has opened up for services for people with adults with autism. I don't know the name of it, but I can figure it out for you and can send you some information on that. I don't think there are any more questions. So I'm going to end the webinar if there are no more questions. Is that okay? Thank you for all to listen to me, and hope if you have any more questions, I'd be able to answer your questions.